din 6 pacienți străini care se internează în clinicii din Austria este român, arată datele unui studiu din 2020, an în care conaționalii noștri au cheltuit acolo peste 3 milioane de euro pe tratamente și îngrijiri medicale. De ce nu la noi, ne întrebăm? Ne răspund tot statisticile. Spitalele austriece ocupă primele locuri la nivel mondial în ceea ce privește rata de vindecare sau perioada de supraviețuire a bolnavilor oncologici.
Clinicile din Austria se numără printre cele mai căutate destinații de către bolnavii de cancer din întreaga Europa. Aceștia găsesc aici o infrastructură medicală modernă și cele mai recente terapii și proceduri pentru aproape toate tipurile de afecțiuni oncologice. Și cum procesul de vindecare începe cu un diagnostic precis, clinicile private din Viena oferă inclusiv proceduri de profilare moleculară a tumorilor.
The diagnosis and the diagnostic approach has clearly improved the management of cancer in two ways. Number one, we can much better characterize the tumor cells, and we can detect features that are relevant for the therapeutic approach. So in the past, we have had just one target, and the target was cellular growth, cellular proliferation, and the medical approach was then chemotherapy to interfere with this abnormal growth. However, now we have learned that there are many features of cancer cells that can be interfered with to stop proliferation, to improve interference with the immune system. So a much more directed treatment approach can be used. And this is based on the accurate diagnosis. So this is one part for the diagnostic approach. The second part is, which is also extremely important, it is the staging of the disease, that we know exactly what is the extent that cancer is present in the body. And we have learned a lot about diagnostics, use of CT, use of MRI, use of PET scanning to improve our ability to define the so-called stage, so the extent of the disease that is present in the patient, and depending on the type of the disease and the stage, a precise treatment concept can be developed.
Un diagnostic de cancer reprezintă un șoc pentru oricine. De aceea, pacienții sunt sfătuiți să obțină o a doua opinie de la o echipă de experți, astfel încât să aibă o imagine mai clară a bolii și să ia o decizie în cunoștință de cauză.
We offer this second opinion. It's possible to get the second opinion on site, but also it is offered as a remote conversation or a remote recommendation. Second opinion includes many aspects. It also includes the possibility to send a diagnostic specimen, a biopsy or a surgical tissue for re-evaluation. And specialists from pathology frequently have a second look at such tissue specimens to confirm the diagnosis, or maybe identify additional treatment targets for an individual approach. Also, diagnostic images like CT scans or MRI scans can be submitted for reinterpretation, and together with the opinion of a specialist, the expert opinion on diagnosis and treatment can be submitted.
Tratamentul modern al afecțiunilor oncologice presupune cooperarea strânsă între diverse discipline. În clinicile private din străinătate, acest lucru este organizat sub forma unui așa numit tumor board.
That modern treatment in oncology is based on cooperation of specialists from various disciplines. To explain it, it means that experts in the field of surgery, of medical oncology, radiotherapy, but also radiology and pathology work together to find an optimal way of managing an individual patient. This interdisciplinary approach, of course, also requires systematic cooperation. And a tumor board is a good example. It means that, for example, when a patient is newly diagnosed with cancer, specialists from these disciplines, as I have just mentioned, meet and discuss diagnosis and treatment. So every discipline can bring the arguments forward why we should do surgery first and chemotherapy second, or the other way around, or combine the treatment modalities. And this is the way of modern oncology to establish the best possible treatment on an individualized basis.
Dacă diagnosticul și tratamentul sunt stabilite de o comisie interdisciplinară, evoluția pacientului este supravegheată de un singur specialist. Acesta asigură îngrijirea bolnavului pe întreaga durată tratamentului și asigură coordonarea cu restul echipei.
The management of a cancer patient requires cooperation of various disciplines. However, there needs to be one specialist who is the leading case manager, coordinating the recommendations and inputs of the various disciplines, and also using diagnostic and therapeutic steps required at the right time. And this is a particular strength of our center, that when a patient is included in a diagnostic or treatment program, there is one specialist who takes the lead and is the primary doctor for this patient. And this doctor coordinates all the functions of the other disciplines.
În ceea ce privește opțiunile de tratament, metodele chirurgicale minim-invazive au început să fie utilizate tot mai frecvent și în cazul afecțiunilor oncologice. Ele pot fi combinate cu terapia medicamentoasă, care duce la micșorarea tumorilor, astfel încât intervențiile chirurgicale să fie mai puțin traumatizante.
The main advance in surgery is use of minimally invasive techniques. So it's not required to do large operations and intensive treatments performed by surgeons to operate a patient, but it's rather the minimally invasive approach that is most frequently used nowadays. This is also a result of cooperation of the various disciplines, in particular the close cooperation between medical treatment and surgery, because one can coordinate the sequence of treatment, and the use of preoperative chemotherapy or preoperative medical treatment is now frequently used to shrink a tumor, and then the operation is performed at a later time point when the tumor is already small, and this facilitates the work for the surgeon, and again it facilitates the minimally invasive approach. As a consequence, also regeneration time for the patient is much shorter, and this is also important when we think about further medical treatment, so the time interval between surgery and the medical treatment can get shorter, and this again improves the outcome in many diseases.
Avans considerabil s-a făcut și în ceea ce privește tratamentul medicamentos al afecțiunilor oncologice.
We have novel medical agents that are targeting the tumor cells more specifically, and it's not the action that also involves the normal cells, but we can direct the treatment towards the cancer cells. So it's not just chemotherapy, and the side effects, by sparing the normal tissue, they can be reduced. This is of great importance for the patients, that the treatment is getting more effective and better tolerable.
În Austria, pacienții beneficiază și de tratament holistic. Pe lângă lupta împotriva cancerului, accentul se pune și pe măsurile care pot crește starea de bine a bolnavului.
In Cancer Center, we also want to involve other disciplines for optimal care of the patient. This includes involvement to coordinate nutrition and diet, to use physical medicine to lead the patient to physical activity. We want to offer psychological treatment. And all these additional steps are important for a comprehensive management of an individual cancer patient. Of course, the later steps I have mentioned, they are always on an individual patient and also on an individual basis. And it's also possible to select from these options. It's not a must, but we offer this to the patients, and many of them are happy to accept it and get a comprehensive management of their individual case.
Cei care doresc să contacteze clinicile din Austria o pot face atât la recepție cât și prin e-mail sau telefon. Majoritatea au și o recepție internațională, unde reprezentanții spitalelor răspund chiar și în limba română întrebărilor pe care le au pacienții străini.